Good afternoon, and thank you for joining us for today's virtual media briefing on COVID-19 in London and Middlesex County. We welcome the media who are in attendance today, and also those of you tuning in, listeners on Global News Radio, AM 980 CFPL, those watching on Rogers TV, as well as the Rogers Facebook page and YouTube channel, and those who are joining us on the CTV London website. As always, today we are joined by London Mayor Ed Holder, as well as the Medical Officer of Health and CEO of the Middlesex-London Health Unit, and we are also very pleased to be joined today by the Warden of Middlesex County, Cathy Burghart-Jesson. To the media, we remind you to submit your questions in the question forum here on Microsoft Teams, indicating your name and your media outlet. We'll get to the opening statements right away, and we'll start with the Warden, Warden Burghart-Jesson.
Great. Well, thanks very much, Dan. And as always, it's great to be with you this afternoon. As things begin to reopen, I just want to point out a few resources that are available to county residents to help them navigate through all the information that we seem to get on what seems to be a minute-to-minute basis. The county's website, middlesex.ca, is a great hub for business resources, community supports, municipal information, and health links. And many of the communities within the county have their own specific tabs on their websites with regards to COVID information in their communities. Many have information lines or emails set up so that should residents have questions with regards to programs that have been announced or information or parameters that we've been receiving, the municipal staff is set up to help navigate them through this. I do want to take this opportunity to thank the municipal staff at all levels, both at the county and then of course the local levels, for all the work that they're doing to go through all the information that we do seem to get every day. Quite often it changes. It's a lot to keep up with, and they've done a great job at keeping up to date with the information that we're receiving. One thing that I would like to point out to county residents is that a number of the departments across the county, particularly Parks and Recreation, they're all working together within municipalities to make sure that the messaging that is going out is consistent. We're trying to make sure that as much of the services that are being offered from municipality to municipality, it's the same message that's getting out to our residents, the same sort of closures with regards to openings, the same sort of openings, and the same sort of timelines are being followed. So if you've got any questions with regards to what's happening in your municipality, please feel free to reach out to people in those offices. And then as our play fields and parks are starting to reopen, just a reminder, it never gets too old that as these things are being opened, physical distancing, of course, still has to be respected, and to keep your distance and make sure that you're honoring that, not only out of respect for yourself and your family, but for those others that are enjoying the facilities that you might be walking through at the time. And with that, I'll pass it over to my friend, Ed.
Well, thanks very much, Cathy, and good afternoon, everyone. You know, today actually marks 2 months since we declared a state of emergency in London due to the COVID-19 pandemic. You know, in some ways it's been a very long 2 months, and in other ways it's felt incredibly short. But regardless of fast or slow, it's been incredibly challenging for everyone, and we know that that pain has been felt to a greater degree by some over others. At the same time, I think it's important to reflect on some of the gains we've made over these last 2 months, even if they may seem minor by comparison. First, as you hear from Dr. Mackie, the number of cases we see on a daily basis is typically in sharp decline, even when compared to this time last month. Similarly, deaths and hospitalizations have also declined. And over the last few days, we've taken the first steps towards reopening our economy while carefully loosening a number of other restrictions. Now, none of this is meant to minimize the struggles and hardships too many have experienced and continue to experience as a result of the pandemic. But that said, I think it's extremely important, in spite of that, to remind ourselves just how far we've come and allow ourselves to imagine how much further we'll progress over the next 2 months. In this case, progress means perseverance and also persistence. So physical distancing, staying home when you're not well, hand washing, and wearing PPE, when appropriate. And very briefly, I also want to talk a little bit about summer camps. As you know, while the Premier announced yesterday that schools would not reopen until September, he also said that summer day camps would be allowed to operate during the summer months of July and August. These camps, both indoor and outdoor, will have to follow strict guidelines to be developed with local public health units, such as ours, the Ministry of Labour, and municipalities. And while those guidelines are still under development, Deputy Mayor Helmer and I did have a conversation today with a wide cross-section of summer camps impacting both the city and our region. And there are a number of key issues. Certainly the most critical is once the established guidelines are put in place, concerns around PPE, the personal protective equipment, parents' concerns being a paramount issue, space requirements, transportation, but you know what's most paramount? And that is the health and safety of the clients and staff of these agencies. So with that, I want to acknowledge this quote-unquote 2-month anniversary in London, and with that, pass it over to Dr. Mackie, please.
Thank you very much, Mr. Mayor and Madam Warden. Your support through all of this has been incredibly important, so thank you to both of you and to the organizations and municipalities that you represent. Really, it is the support of all of the people in this region that has made the Middlesex and London experience so different from that in the rest of the province. Our neighbors to the west, our neighbors to the east have had much higher rates of infection than we have here. And it's only because of Londoners and people living in Middlesex who have been so careful that our numbers have stayed low. We had another significant number of cases reported today at the provincial level, 390 cases, which is quite high compared to the previous week or so. And then locally, we only had 3 cases reported and no deaths locally. I'm going to take you to the epi curves for the province and the region to show exactly what I'm talking about in terms of the differentiation between the curves in the 2 areas, if you'll just allow me. So we'll start with the provincial curve. So this is on the right, with the blue and orange, are the cases that we call the epi curve here. So if you ignore the orange for a moment, that orange are the dates the cases get reported, which are always delayed because people take time before they become ill to get the test, and then the test takes time to come back. What I'd like to look at is the blue cases, the blue bars, which are the cases by episode date. And remembering that there is that delay, you can ignore about the last week or so of the epi curve data. Essentially, when you look at these this week or so, the last week or so, what you see is that the numbers are already similar to the previous week. And since we know that week will fill in as future cases get reported, what actually looks like is happening is this last week or so is higher than the previous week at the provincial level. That's a significant bump. If you look at the number of cases reported each day, it's the same trend and would validate that we actually might be seeing a slight increased trend in cases in Ontario over the past week or so. And I'll contrast that here as we look at the cases by episode date in Middlesex and London. What you see here, the last week is actually lower than the average of the previous week. Green, gray, and light gray are all cases, just depending on where they are in the community versus retirement homes. And again, these are by episode date here. That means when the person first becomes ill. You don't see that trend where the last week or so is going to be catching up and exceeding the previous week here in Middlesex and London. So that's quite reassuring. But again, we are still seeing deaths, and we're still seeing more cases here than we want. So we're certainly not out of the woods here. And of course, as our neighbors continue to have outbreaks in the GTA and in the communities that border on Michigan, those numbers will continue to put pressure on our numbers here as well. So we won't be out of the woods until this whole province is out of the woods. That's it for me today, Dan. Happy to take any questions. You're on mute.
Thank you very much. Yes, thank you very much, Dr. Mackie, Warden Burghart-Jesson, and Mr. Mayor. Well, we do have questions lined up, so let's get to those right away. The first, Dr. Mackie, is for you. It's from Steve Young at CTV London. Dr. Mackie, what is your reaction to the announcement from the Premier that he is going to launch a probe into long-term care homes? Is this long overdue?
Well, I would say that as a society, we generally don't care for the elderly as much as they deserve. So I know that long-term care homes do the best with the resources that they have. And one of the things that unfortunately hasn't been available in long-term cares over the last couple of months is the support of family and friends, because often visitors play a key role in providing care for people in long-term care. And that hasn't been possible because of the pandemic. But certainly, I would welcome the attention on some of our most vulnerable citizens. This is a segment of the population that doesn't have a lot of options in terms of where they live and how they live their lives. And I think if the province can turn some attention there and make sure that they are being cared for safely, I think that's a real positive.
Right. The next question, Dr. Mackie, is also for you. It comes from Grant Demi, who is with My FM Radio in Strathroy. Dr. Mackie, Ontario processed just under 7,400 tests in the past 24 hours. What are your thoughts on that amount at this stage in the pandemic? And did Middlesex-London also see a dip in tests administered yesterday as well?
And so one of the things that is becoming really clear that needs to change about the healthcare system, very broadly speaking, is that the healthcare system in Ontario is really a Monday to Friday operation. And over the weekend, it's kind of a keep the lights on situation. And so what you're seeing in terms of today and yesterday, the case counts have declined. The tests processed have declined because there were less swabs taken over the weekend. That's been a very consistent trend since the very beginning of this outbreak. We see less tests taken over the weekend. And actually part of that is because of consumer behavior as well. If you look at assessment center numbers here in London, where we have 2 assessment centers, we do close one of those assessment centers on the weekends, but the one that remains open actually sees a drop in visits on the weekend as well. So you might think we're closing one down on the weekend, the other one would see more visits, but it's not actually the case. Less people seek care on the weekend than during the week. And so it's not surprising at all that on a Monday or Tuesday after a long weekend that you see less tests being processed. That's because less samples were taken over the weekend because there was simply less healthcare operating over the weekend.
Okay. Thank you for clarifying that. That's great. And the next question, Mr. Mayor, is for you. It comes from Dan Brown at the London Free Press. Mayor Holder, how do you think the partial reopening of some stores and services went yesterday? Did you hear of any glitches or problems?
I think, Dan, the answer was a bit of a mix because there were a number of stores that could have been open and chose on their own that they weren't quite ready to proceed. I think the response is generally positive but mixed. Positive in that I think both retailers and other businesses not initially deemed essential were really truly looking forward to getting back to business. And from a consumer standpoint, it's the same thing. People were looking to have options for shopping and I'm sure not just have an outing. I think we're well past that. So I would say that we will get better at this as more flexibility occurs within the system, more flexibility in terms of how we open. But again, keeping in mind that even with restaurants, where ultimately with physical distancing, even in our own families, retail businesses where these are smaller shops, I would tell you that it will be limited in terms of the number of individuals that can go into the shop at any given time. And those are the kinds of rules that we're asking people to pay attention to. Physical distancing, numbers of client guests in a given shop. Those are the types of things. My family wears a mask when they serve their public. So, and everyone is treating that somewhat differently, but I would tell you, I think that we're going through a big adjustment phase, generally well, to be specific, but I think it's going to be a moving target as more stores open and as some of the restrictions are loosened as well. Always with the safety of individuals to be paramount. I'm not sure what the warden's experience is in the county with respect to her shops, but certainly in London, that has been mine.
Madam Warden, would you like to respond as well?
Yes, thanks very much for that. I would echo what the mayor has said in that, a couple of weeks ago, retailers, were itching to open. And then when they were given the go-ahead, now they've kind of taken a cautious step back. And I would say that it's been a very slow opening. A number of our independent stores are really setting actually a target date of June 1st to open, taking into consideration safety measures that they have to put in place for their staff, for their clients, whether it's regards to some plexiglass or PPE products that they need to purchase. But, the words cautious, slow and steady, that's what I'm hearing over and over again. And I think, too, that the public is respecting that. While everybody is anxious to get out and spend some money in their communities, I know I am, I think everybody realizes that, as the mayor said, the safety of staff and clients is paramount. And when they open those doors, they want to make sure that they get it right. So that's what I'm hearing from across the county.
All right. Thank you, Madam Warden. Thank you, Mr. Mayor. Dr. Mackie, we're heading back to you for the next one. Dan Brown at the London Free Press would like to know, he says, we had 3 new cases in the last 24 hours. So is it looking like the 11 new cases after the weekend was the usual blip we see every weekend and not a cause for concern?
Yes, I would say that it's encouraging that those numbers have come down. Again, we are a relatively small jurisdiction compared to the province, so you will see those numbers continue to bounce around a bit. One day isn't cause for concern, but we're watching those longer term trends, the 3-day and the 5-day moving averages. And as those climb up, that would be the time where we really start to be concerned. But at this point, we're still in very much a watchful waiting sort of situation.
All right. Thank you, Dr. Mackie. Sophia Rodriguez from CBC London has a question for you. Dr. Mackie, will the health unit be working with school boards on a plan for the return of classes in September now that we know the school year is canceled? What do you think are some of the measures schools will need to implement?
We're certainly open to, we're working with partners across public, private, not-for-profit sectors right now, everyone asking those same questions. How do we operate safely once we do reopen? We have a guidance document that has a set of principles that many of which would apply in school boards. One thing that I think will be challenging but important for schools to implement is a really rigorous screening approach. If you visited a healthcare facility lately, you know that there's active screening happening, not just a poster that says, if you have flu-like symptoms, please visit another day, but somebody sitting there asking each person if they have symptoms. And I would anticipate that something like that needs to happen in schools in order to make sure that staff and children who are ill aren't putting other students and staff at risk.
All right. Thank you, Dr. Mackie. The next question, Madam Warden, is for you. It comes from Grant Demi at My FM Radio in Strathroy. Were there any incidents you were made aware of during the long weekend where county residents violated COVID-19 regulations?
Well, thanks very much for that question, Grant. And nothing has been brought to my attention over the last 24 hours with regards to any charges that were laid or concerns that were brought to the attention either to bylaw or to the OPP. I do know that the different bylaw enforcement officers across the county at the local level, they did step up their watch, and we're monitoring hotspots, so to speak, as to where people would gather. And as I say, nothing has been brought to my attention that was of concern.
All right. Mayor Holder, the next question is for you. It comes from Sawyer Bogdan at AM 980 CFPL. Mayor Holder, one of our listeners would like to know if there are any updates on the protocols for riders and drivers on the LTC. Do riders need to wear masks?
At this point, the practice that we have put in place that seems to have been working fairly well remains in place. So what we have is as opposed to the front of the bus entry, we have a rear of the bus entry. By virtue of that, people are not paying fares because that would involve traveling past individuals in pretty close proximity, and at the same time putting the potential of those passengers and the bus operators at some risk. As a result of that, there are no fare changes. In other words, there will be no costs to go onto the bus at this time. We are practicing physical distancing at this time, and in addition to that, we are limiting the number of people on the bus, and those are the rules that have been put in place and maintained to this stage.
Okay. Mr. Mayor, there was a question about masks. Has there been any discussion about masks for people riding the bus, or is that, as it has been, sort of a personal decision at this point?
Well, I would say to you at this point, I'll refer a comment over to Dr. Mackie for that, but I would come back to you and say that the issues about personal protective equipment are always an issue that's of concern both for the operators as well as for passengers as well. Perhaps Dr. Mackie would like to add a piece to that.
Happy to, Mr. Mayor. So the question around use of masks in places like buses where it may be difficult to keep 6 feet apart, certainly that's a recommendation of the provincial government at this point. It's one that we're happy to support, but it's really a may-if recommendation. It's not a thou shalt, because we know that there are risks to wearing masks if they're not worn properly. And also, even if they are worn properly, it's easy to accidentally touch your face more, adjusting the mask, itching where the mask might be. And most importantly, the mask, a non-surgical mask in a public environment doesn't do a great job of protecting the mask wearer. It's more helpful for protecting the people around that person in case the person wearing a mask coughs or sneezes. But for the person wearing, it definitely does not create the same sort of protection that physical distancing at least 6 feet would. So in those environments, you may wear a mask if you feel that it will make you feel better or safer, but you need to be aware of the risks and the limitations.
All right. Thank you, Dr. Mackie. Thank you, Warden Burghart-Jesson. Thank you, Mr. Mayor. That brings us to the end of the road when it comes to questions on today's virtual media briefing. I'd like to thank all of you once again for participating and for bringing this information for our community and for our local media. To all of you who've joined us today, thank you for being there, and we look forward to speaking with you again tomorrow. Have a great rest of the day.